This is Kathy Knipfer, instructor for Nursing 2313, recording the Community-Based Nursing Lecture for Chapter 11, entitled Practice Settings and Specialties. Let's begin a discussion of practice settings. The U.S. Department of Labor, Bureau of Labor Statistics in 2010 estimates that there will be a 22% increase in the need for nurses by 2018. Growth in other nursing jobs is increasing, such as in physician offices, home health, and long-term care. Also, more will work in nursing-based clinics, health maintenance organizations, federal agencies, health planning agencies, jails and prisons, insurance companies, pharmaceutical companies, as well as companies who provide durable medical equipment. The hospital will remain the major site of nursing practice. Nurses who function in the hospital will serve as an administrator or a manager. They will assess and monitor client health status. They will provide direct care and coordinate care by others. They will teach the client and family. They will provide support for family members as well as make referrals. Practice settings in home care could include living at home networks or block nursing programs. These would incorporate professional and volunteer services in a neighborhood for the elderly. The goal would be to avoid nursing home placement. Another practice setting would be adult daycare or adult foster care. There's also parish nursing, where health education is provided along with counseling, referrals, volunteer training, outreach, collaboration, health advocacy, and promotion of self-care. Nursing functions in home care include assessing the client family and culture, assessing the home and community environment, developing relationships based on mutual trust, contacting the physician regarding a client's condition, planning, implementing, and evaluating the plans of care, providing direct care and coordinating care by others, teaching the client and family, providing support as well as making referrals. Other practice settings include residential care for the elderly, such as retirement communities, assisted living facilities, extended care facilities or skilled nursing facilities, subacute rehabilitation centers, or a boarding care home. These boarding care homes do not have nursing or medical supervision, but they may assist with activities of daily living. Other practice settings are residential care across the lifespan. These would include shelters for partner violence, homeless shelters and transitional housing, camps, rehabilitation centers, detoxification facilities, and treatment facilities for addictions. Nurses function in residential care by providing direct care and coordinating services, by providing health assessments and assessment of condition, by providing health promotion and prevention, as well as counseling and support. The nurse also makes referrals and collaborates with other healthcare team members and can serve as an administrator. Ambulatory care practice settings include clinics, physicians' offices, day surgery, community health centers or daycare centers, also mental health services, maternal and well child services, nutrition services, senior citizen centers, as well as nursing centers. Nursing functions in a clinic or in ambulatory care include health assessments, assisting the primary care provider or may be the primary care provider, providing direct care and coordinating care given by others, teaching clients and families, planning, implementing, and evaluating plans of care, providing health promotion and disease prevention, as well as serving as a client advocate. Practice settings in schools include daycare centers, preschools, elementary and secondary schools, as well as colleges and universities. School nurses are often the only or major source of health assessment, health education, and emergency care for our children. School health programs may include identification of communicable, chronic, or disabling diseases, immunizations, as well as safety and health education. School nurse functions and competencies. The school nurse must be competent in health teaching, delegated medical functions, collaboration, counseling, case finding, consultation, referral and follow up, advocacy, as well as case management. Functions include conducting screenings, health assessments, first aid and emergency care, health education, providing health promotion and disease prevention, counseling and support, and making referrals. Now let's discuss occupational health practice settings. The health and well-being of employees are vital to morale and productivity. The focus of occupational health is to keep employees healthy, prevent illness and accidents, providing assistance to the employee returning to work, and ensuring a safe business or industrial environment. In this practice setting, the nurse would focus on worksite health promotion, employee wellness programs, as well as employee assistance programs. The occupational health nurse functions by performing health screenings and health assessments, providing first aid and emergency care, providing health education, health promotion and disease prevention, and also acting as a counselor and providing support. This nurse also makes referrals. Disaster nursing. In this practice setting, it has been traditionally provided through the American Red Cross. More than 30,000 nurses are in paid and volunteer positions at the Red Cross. Activities consist of providing direct assistance in times of crisis, developing and teaching courses, acting in management and supervisory roles. To be prepared, nurses benefit from first developing their own home disaster plan, and they should understand the medical management of biological exposure as well as self-protection while involved in care provision. Nursing specialties may reflect the practice setting, such as being a school nurse, or they may reflect their area of expertise, such as health educator. They may reflect additional education or certification. Advanced practice nurses include nurse practitioners, clinical nurse specialists, as well as certified nurse midwives. In summary, changes have occurred in healthcare delivery in the community, providing opportunities for the practice of nursing in a variety of settings. So opportunities exist for specialization. Advanced practice nursing has expanded dramatically. Principles of community-based nursing applies to all settings and roles. Question number 1. The community-based service that depends on professionals and volunteer services of neighborhood residents to provide information, social support, skilled nursing care, and other assistance to promote self-sufficiency in the elderly is A. Block nurse program, B. Senior center, C. Adult daycare, or D. Subacute rehabilitation center. The answer is A. Block nurse program. The rationale is the block nurse program is community-based service that depends on professionals and volunteer services of neighborhood residents to provide information, social support, skilled nursing care, and other assistance to promote self-sufficiency in the elderly. This can range from arranging for Boy Scouts to do yard work to making referrals for transportation to medical appointments. Question number 2. The advanced practice nurse who focuses on a special area of expertise such as diabetes or oncology for the purpose of improving clinical care is known as A. Nurse practitioner, B. Certified nurse midwife, C. Clinical nurse specialist, or D. Health education specialist. The answer is C. Clinical nurse specialist. The rationale is the clinical nurse specialist, or CNS, is an advanced practice nurse who focuses on a particular area of expertise. The CNS education and role focuses on improving clinical care, primarily in hospitals and extended care facilities, by having an expert nurse.